Are you scared of needles, Julie?
I don't care for needles.
I look away. I mean, I'm not.
I do too.
Yeah, I'm not. I don't want to see it.
I don't either.
But maybe I should be looking more closely.
Maybe you should. We've got a bit of a health segment to share with you, particularly baby boomers, because between the years of 1945 and 1965, a lot of people contracted hepatitis C. Now, I remember first hearing about this when Naomi Judd was diagnosed. Remember the
Oh my gosh, yeah. I
Mama
guess
Judd?
So, yeah.
So it's important information that you might need to know because you could have it and you don't even know it.
Mary Snell has the information.
Well, Nancy, I'm going to be honest with you. When I started researching this topic, I really found myself with a lot of misinformation, a lot of misconception about this disease. So I'm really, here to try to get some information on diagnosis all the way up to treatment. So let's get started. What actually is hepatitis C?
Hepatitis C is an inflammation of the liver. If you look at medical terminology, itis always means inflammation, and hepa refers to liver. So hepatitis is the inflammation of the liver, and then there's several different varieties of the different hepatitis infections.
And what we're talking specifically is hepatitis C. Now, here again, what are the different risk factors for this particular virus infection?
Well, it's a blood-to-blood infection. The baby boomers between 1945 and 1965 are at particularly high risk because so many things weren't known when they were in their younger years as far as some of the behaviors. Back in the 80s, the drug use was so high. So anybody that did intravenous drugs, or even back in the 80s when the cocaine problem was so big, if you use a straw that someone else had used, that can do it. If you're a healthcare worker, obviously, anybody that has received hemodialysis is at risk. Blood transfusions before 1992, if you had, for example, any kind of a disease that you needed clotting products, before 1987 the clotting products were not checked for the hepatitis C. So there's all different sorts of behaviors that people never even think that they're innocent behaviors that maybe was treated in a doctor's office or hospital, but still put them at risk.
Well, I'm sure there are individuals thinking, well, I don't have any signs or symptoms and I feel fine. Are there signs and symptoms that can maybe prompt someone to seek medical treatment?
There are signs, but the problem is the signs don't usually appear until there's actual damage of the liver occurring. Once the disease has progressed so far, it starts a process called fibrosis, which is the scarring of the liver. If unchecked, it will eventually lead to cirrhosis. So by the time you're getting into the fibrosis, you may have itchy skin, you can bruise easily, very tired, loss of appetite, all kinds of very general things that people don't really think, oh, this is a disease. And so, but like I said, and by the time those actually occur, it's often, a little bit late. So what you need to do, especially if you're in that baby boomer category or any of the high-risk behaviors, you need to be proactive and ask your doctor to do a simple blood test to see if you do have the hepatitis C antibodies. If you have the antibodies present, then you need a second blood draw to verify that you have active hepatitis C at that point.
Wouldn't this be part of just maybe a routine blood test that we have done, every year as part of our physical exam?
I wish it was, but unfortunately they don't do it as a regular blood test, and your typical blood panel just does not show if you have the hepatitis C. So unless the doctor suspects from something you've told him that you are at a very high risk, most likely he will not be proactive and do that. So that's why you need to take it upon yourself to be proactive and request one.
I think that's great. And I think everybody needs to be sort of their own advocate for health care, definitely. So if you are planning to have a physical exam, for instance, coming up, that is something you want to make sure you put on the radar, ask for a blood test to be screened for hepatitis C. I am so thrilled that you were here with us and really enlightened us on what hepatitis C is and what we can actually do for ourselves, a very simple blood test.
Well, thank you so much for having me, Mary.
And I'm Mary Snell with Boomer TV.